Welcome, everyone. Thank you for joining us today. We've got some exciting news of some upcoming changes with Medicare enrollment, and we wanted to share some of that information with you today. My name is Matt Zablotny. I'm the president of ZMark Health, and joining me today is Sarah Eister. She is one of our senior consultants. Hello, Sarah.
Hey, Matt. Thanks for having me.
You're very, very welcome. ZMark Health is an organization that helps providers with all things reimbursement, credentialing, RCM, all those things. And we wanted to provide some information for you today on these upcoming changes with Medicare and how they can have a positive impact on your organization and some of the things that you may need to do. So, Sarah, what are some of these changes and how did we get here?
So for the first time in a long time, the Center for Medicaid and Medicare Services is allowing marriage and family therapists along with mental health counselors to bill Medicare Part B directly. It's a huge change. It's a legislative change, Matt. It's the work of a lot of advocates, and certainly pandemic has established the need for additional mental health services in our country. With CMS acknowledging that, I just want to say that prior to 2023, they didn't have the regulatory authority to create new reimbursement practitioner types. So thankfully, Congress established the Consolidated Appropriations Act, and that is what created this new benefit category. So very exciting. Marriage and family therapists, mental health counselors, you're bringing you on. And one of the great things that I was reading while we were working on this, Matt, was that the potential for 225,000 more licensed mental health professionals could come on board with this enrollment allowance.
That's fantastic. That's fantastic. Well, very, very good news. So tell us a little bit more about what this means specifically for these practitioner types.
Sure. The final ruling actually allows marriage and family therapists and mental health counselors to bill for the diagnosis and treatment of mental illness. It is exclusive. Inpatient is not included, nor is skilled nursing. But one of the great things is that these MFTs and MHCs can work in the FQHCs, the federally qualified health centers, and in rural clinics, as well as hospice. And so when they're credentialed, they can bill Medicare Part B at 80% of the lesser of either of these, the actual charge, or at 75% of the payment of a psychologist. So again, no more Incident 2 billing. You can directly enroll. It's great movement for our industry.
That's fantastic. That'll make it a little bit easier for providers, that's for sure.
For sure.
Okay, so what do they have to do?
So beginning now, today is November 14th. Now through January 1st and beyond, you can begin submitting enrollment applications if you are interested in becoming Medicare billable. And so just to make sure that everybody's defined, I have it up here. You have to have a master's or a doctorate degree for a marriage and family therapist or mental health counselor. You have to be licensed or certified in the state in which you're performing services. The 2-year supervision, clinical supervision in marriage and family therapy or mental health counseling is critical, and it is very specific in the rule about how that is to be proven. And then the final piece is meets other requirements as the Secretary of Health and Human Services determines appropriate. And as of this conversation, we don't know of any.
Okay, well, that's very good. Very, very good. This process with Medicare, this enrollment process, what does it usually look like? How long does it take?
It takes a little while. So first of all, you have to get an NPI number if you don't already have one as a marriage and family therapist or a mental health counselor. Then you have to apply it potentially online. You can use, it's called PICOS, the Provider Enrollment Chain and Ownership System, or you can apply it via paper using the CMS 855I. But you have to then enroll for every state. If you're on the border of a state and you're doing practice in both states, you have to enroll in both states. The good news is that CMS is saying that clean electronic application. So if you go into PICOS and submit that way, that a clean application can be processed within 15 days following receipt of that, which is pretty impressive. And then clean paper applications, that's the 855I, will be processed within 30 calendar days of receipt. Again, not so bad. However, if you don't submit a clean application, then you have to, they will notify you. CMS, it's actually the Medicare, it's called the MAC, the Medicare Advisory, say it's there, excuse me, administrative contractor will reach out and you have up to 30 days to respond. So you're not dead in the water if you have a mistake on it.
Very good. Very good. That makes total sense.
Yep.
Fantastic. And then they'll get notified once this enrollment has been processed.
Exactly right. So they will each recipient, excuse me, each applicant will receive an enrollment approval letter, and they get their own PATAN, which is a provider transaction access number. That's not a number that's used a whole lot, but it is used every time you're interacting with the Medicare Administrative Contracting Organization. So it's yours specifically, and of course it will indicate your NPI number because you had to have that to apply, so that you can go ahead and move forward with billing Medicare Part B.
Very, very good. Very, very good. Well, thank you for that quick
Yeah,
overview. I'll give just a quick synopsis
please.
of this. So our firm is known for our work in credentialing. We help providers nationally with enrollment and obtaining certification and things with these different payers, and we can certainly help with this work as well. So if you have these therapists that need enrolled with Medicare, it's certainly something we can assist you with, or even give you a little bit of training on how to do it yourself. That's fine too. So any of the things that you need when it comes to enrollment, our firm can definitely assist you with. Uh, Incidentally, our company has started a new software called Exidoc, which is a credentialing and contracting software. So if you're interested in having all of your credentialing information in one place, having all of your contract information and contract copies all scanned in one place, well, this software can do all those things for you. And it's really kicking off this quarter. So we've got some providers that are starting to get in there and use it for us a little bit, but it's a great way to just keep everything organized for you and right at your fingertips as you're working to enroll practitioners with these various insurance companies, including Medicare. So we'll leave this last slide up here for just a second. It gives our contact information. If you have any questions at all, any need for help, anything, don't hesitate to reach out to either of us. Our company is happy to help you. So with that, Sarah, I think we'll sign off. Thank you for all your help and all of your insights. I think it was very, very good and will be helpful for these providers. So thanks again, everyone, and have a great day.
Thank you.